So my name is Alex Trimble, and for my lightning strike, I've chosen to do ankle sprains. This semester, I was assigned to the women's field hockey team here at Longwood. These girls are some of the most aggressive players that I have ever met, and I've seen a lot of sports, which may account for how many injuries they have sustained this season. In my research, I have found that overall injuries in gameplay of field hockey have decreased 2.5% annually over the last 15 years, which is really good. Despite that, ankle ligament sprains account for 13.7% of game injuries and 15% of practice injuries, which is huge. While concussions, abrasions, and hand, finger, thumb injuries are also pretty common in the sport, none are more common than the lower body injuries. My Pico question for this lightning strike was as followed. In collegiate field hockey players with inversion ankle sprains, would the intervention of taping/bracing or balance training be more effective in preventing further injury to the ankle? An example of the balance training I was talking about is right here. She gets progressively harder as the training goes on. Keep in mind that the person doing these exercises actually has no injury to the ankle at all. While she has sustained injury in the past, she is pain-free when she does these. As we can see, we all know what an ankle taping or ankle brace looks like, so I don't feel the need to go into what those are as much. Throughout my research, I have come across many pros and cons to both interventions. For ankle taping, after a certain amount of activity, the tape loosens, and is not as effective. For bracing, if it doesn't fit correctly or if the brace digs into the ankle, the athlete will become uncomfortable, which could lead to more problems overall. I actually had an athlete who refused to wear her brace because it hurt her to do so because it dug into her skin so much this semester. Finally, with balance training, the amount the athlete can gain with this intervention is almost up to them. While an athletic trainer can tell the patient what to do, give them all the exercises and all the tools, the athletic trainer can't watch that patient day and night. The athlete has to want to do the training, even when they can't be in an athletic training clinic setting doing the exercises, even if they have to do them at home. They have to want to do it. In my research, I've come to the realization that taping and bracing and balance training can't be put into a category for one over the other. Both are needed for the athlete to heal fully with a less chance of re-injury. Taping and bracing should be applied during the early stages of return to play and while the athlete has pain or feels that their ankle is unstable. While continuing with balance training throughout rehabilitation and beyond will put the athlete at a lesser risk of re-injury by a large margin. So large, in fact, that in my personal opinion, I think balance training should be continued even months after the injury to the ankle occurred in the first place. While both of these interventions are highly used throughout clinic practice, I do believe that some athletes are put back into the field before they're actually ready to be so on account of how many re-injury of the ankle is so common. And I think that the purpose of the balance training would help immensely in keeping the athletes from re-injuring that ankle. And that's all. I did it well enough.